Ladies and gentlemen, thank you for standing by. Welcome to the Essentials for Childhood webinar. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded, Tuesday, April 1st, 2014. I would now like to turn the conference over to Lynn Shaken. Please go ahead, ma'am.
Thank you. Good afternoon, everyone. My name is Lynn Shaken, and I'm with the Injury Prevention and Behavioral Health Team here at the Association of State and Territorial Health Officials. I would like to welcome you to today's webinar, Essentials for Childhood, CDC's Framework for Preventing Child Maltreatment. With support from the Centers for Disease Control and Prevention, ASTHO is hosting this first in a series of 5 webinars that will feature the Essentials for Childhood. The objectives for today's webinar are to cover the following: why Essentials for Childhood is CDC's vision and framework for child maltreatment prevention, 4 key goal areas and action steps for each that can help frame collective action for prevention, and how state health departments and their partners are using Essentials for Childhood in community efforts for preventing child maltreatment and adverse childhood experiences. We have a wonderful panel of experts that will be speaking today. Following my introductions, we will be treated to their 4 presentations. At the end of today's webinar, you'll be directed to an evaluation survey, so please take a few minutes to provide us with feedback. Also, to submit a question, there will be a brief question and answer period at the end of today's webinar. So if you have a question, please write it in to us via the chat box that you see on your screen at any point during the presentation. We will take note of your questions and then return to them during the Q&A. So our first speakers, I'll move to your first slide. Our first speakers are Sandra Alexander and Renee Wright. Both join us from the Division of Violence Prevention in the National Center for Injury Prevention and Control at the Centers for Disease Control and Prevention. Sandra Alexander is a subject matter expert in child maltreatment and represents CDC on national child maltreatment initiatives including the Federal Interagency Child Maltreatment Workgroup and the National Coalition to Prevent Child Sexual Abuse and Exploitation. For 13 years, Renee Wright has worked as a public health advisor at CDC, supporting multiple programs in the areas of child maltreatment, sexual violence, and intimate partner violence. So without any further ado, I'll hand it over to Sandra and Renee.
Thank you, Lynn, and we are delighted to have the opportunity to work with you and ASTHO to do this webinar series. And today we're going to try to very quickly give you an overview of our work with Essentials for Childhood, why we think it's important, and some of the work we're doing with our partners around the country. So, other than the people who are on the phone, I think when most of the population thinks about child maltreatment, they probably would picture or think about bruises, broken bones, possibly neglect, maybe some emotional neglect. But most often, they probably wouldn't also think about difficulties in learning in school or bullying or even problems in the workplace later on. They might not think about health problems like heart disease, lung disease, mental health problems like depression. But what we know and have research to show is that adverse childhood experiences can impact both later health and also physical and mental health, but also down the road even have workplace productivity issues. We also know that adverse childhood experiences like child maltreatment, like other kinds of violence, can lead to greater involvement in our health services, our mental health, social services, juvenile justice system services. So in addition to the very personal impact of adverse childhood experiences, you can see that there's also a fairly large economic impact as well. It's because of the significant health burden of adverse childhood experiences like child maltreatment that preventing violence and other adverse childhood experiences to children and youth is a focus of the National Center for Injury Prevention and Control here at CDC. While we know that the pileup of adverse childhood experiences can negatively impact health and well-being, we also know that children who have the opportunity to be in safe and stable and nurturing relationships and environments are more likely to be healthy adolescents and adults, as well as more productive as they grow older and they are able to reach their full potential. We're focused on safe, stable, and nurturing relationships and environments because we know that that's how children experience their world. We believe that safe, stable, nurturing relationships and environments in the caregiving, but also in the broader environments that they experience, are really key essentials for healthy child growth and development, for later educational achievement, for building better employees, safer communities, a stronger economy, and stronger future parents. And they can also help prevent other forms of violence. So Essentials for Childhood, assuring safe, stable, nurturing relationships and environments, is the umbrella for all of our child maltreatment prevention work. And it's an important role for us in public health. It's also the vision for what we want for all children. So in order for that to happen, we have to really understand the social determinants of health and how to integrate health equity into all of our essentials work and our child maltreatment work. That's going to be critical for us to achieve this vision. So what do we mean by safe, stable, and nurturing? Safety is the extent to which a child is free from fear and secure from physical or psychological harm in their social and their broader physical environment. Stability is the degree of predictability and consistency in their environments and in their caregiving. And nurturing is the extent to which a parent or a caregiver is available to respond sensitively and meet their needs in an appropriate manner. It's really important, we know, for children to have these kinds of relationships and environments from the very beginning. But it's also important for them to have them in their other contacts that they have, whether it be in a child care environment or in school or in a sports environment. And particularly if they haven't had them at home, it's really important for them to have them outside of the home and with other people. And we now have research that shows us that these kinds of relationships and environments are just as important for us as adults in order for us to be able to provide them to children. So our Essentials for Childhood document, which I expect many of you have seen, and if not, I hope you'll take a look at, will give a lot more information than we're able to give today, but it proposes several key areas and actions to help promote safe, stable, nurturing relationships and environments. And the first area is raising awareness and commitment to support this. And we mean more than just doing a public awareness campaign, but really working with partners across many different sectors to build commitment to actually take action. The second area is using data to inform the actions that we take. So taking a look at what data is available to us already, and the Essentials for Childhood document lists many different sources for data, identifying what else is needed and finding the partners to help get that, and then using that data to help inform the actions that we take. The third area is creating the context for healthy children and families through norm change and programs. So really taking a look at what are the norms and figuring out how to promote the norm that we all have a responsibility for the well-being of children, and the importance of using evidence-based programs in the work that we do. The fourth area is creating the context for healthy children and families through policies. That means identifying the policies that support safe, stable, nurturing relationships and environments, and using the data that we have to help decision makers make informed decisions. If we do work in all four of those goal areas I just mentioned. So it's really important that we focus on all of them. For example, if you did have a policy you wanted to put forward, you would certainly want to have awareness and commitment for why it was important. To have the support for it, you would need the data to make the case, and you would hopefully have some good strategy that you could put forward that the policy would support or promote. The other area is to really make a deliberate effort to moving from what we often do, and that's doing good work, but having isolated impact, where we have many different groups working independently. And what we need to think about is how do we move more to collective impact. Now, collective impact is more than just having more collaborations and partnerships like we typically have. It requires a real systemic approach that focuses on the relationship between organizations and the work towards shared objectives. We feel that this is a good way to really have greater impact and large social scale impact. So Renee is going to talk to us now about the work we're doing in Essentials for Childhood and how we're using collective impact in this work.
Good afternoon. In the fall of 2013, CDC funded 5 state health departments, California, Colorado, Massachusetts, North Carolina, and Washington, for a 5-year period to implement the Essentials for Childhood guidance and support sustainable multi-sectorial efforts that promote safe, stable, nurturing relationships and environments. The efforts must incorporate all 4 goal areas in the guidance, use the collective impact approach to implement their work, and integrate health equity into their work. Required partners include their state CBCAP lead agency, their core violence and injury prevention program if they have one in their state, at least one of the following: their state chapter or affiliate of Prevent Child Abuse America, Alliance for Children's Trust and Prevention funds, and or Parents Anonymous, and at least one business partner. We invited non-funded states to participate in the Essentials for Childhood initiative as well, and we are so very pleased that to date, over 20 states have expressed an interest to participate at varying degrees. To support this initiative, CDC is providing related training, technical assistance, and various resources, including some supplementary pieces which are listed on the slide. 2 pieces, raising awareness and commitment and promoting positive community norms, we expect to be available within the next couple weeks. Essentials for Parenting, which is a web-based platform hosted by CDC, is a resource designed for parents of young children and will launch this spring. Raising of America, which can be used to support Goal 1 of raising awareness and commitment, is a multimedia initiative and public engagement campaign that explores how a strong start for all children can lead to a healthier and more equitable America. The main documentary will be officially launched in the fall, but shorter pieces are already available. We anticipate the media and business supplementary pieces listed will be available in the next several months. As I mentioned, states must use collective impact, which involves 5 key elements: developing a common agenda as in an agreed-upon vision shared by all key partners, having shared measurement, which also means shared accountability, having mutually reinforcing activities, so even though there will be varied approaches given the different partners and sectors that are brought together, they're coordinated through a joint plan, consistent and open communication, and finally, a backbone organization or organizations that have the skills and resources to convene and coordinate partners. In addition to these key elements, I wanted to add that there are a couple intangibles that influence collective impact success, and they include relationship building and trust, fostering connections between people, leadership, creating a culture of learning, and last but not least, the power of hope. I want to highlight backbone organizations because they play a critical role in the collective impact process. They engage in the activities you see listed, having to balance the tension between coordinating and maintaining accountability while staying behind the scenes to establish collective ownership. It's important to note that backbones do not set the agenda, nor do they drive the solution. They're really coordinating, connecting, guiding, communicating, keeping the work moving. Good backbone organizations serve as a bridge between the different sectors and partners. Another metaphor that's been used for them is that they're like a quarterback who doesn't end up in the end zone, but they're the ones handing it off, making a pass, or calling a different play if the defense looks different. This is a general timeline for the first 18 months of collective impact, highlighting the first 6 months on the top half of the slide. The first 6 months typically focus on understanding the landscape and involving the right stakeholders. And by the latter, I mean not just assuring you have a representative from a key agency, but the person from within that agency who has both influence and the time and ability to remain engaged in the process. This time period is really about laying the foundation for the work ahead, which is why it's so important to take the time to do this foundational work well. In just a moment, you'll hear from a couple states who will talk about their Essentials for Childhood work relevant to that time frame. Our emails are provided along with a few other resources, and as I saw in the chat box, if you were paying attention to that, all of these will be made available to you, the presentation, so you'll be able to access and refer to these resources in the future. Thank you.
Wonderful. Thank you, Sandra and Renee, for laying that Essentials for Childhood foundation for us. And so without any further ado, we can move to our next speaker, Sarah Hernandez. And I will pull up your first slide, Sarah. Sarah Hernandez is responsible for implementing the Essentials for Childhood project thanks to funding provided by CDC, and she is the Child Maltreatment Prevention Coordinator at the Colorado Department of Public Health and Environment. She previously worked as the program coordinator for home visiting programs at the state level and has worked on several public health initiatives at a local level. So I will pass the baton to you, Sarah, to start your presentation.
Great. Good afternoon. So I'm going to start by just briefly showing you all our leadership team who has been in place. Who has been in place for about 5 months now. What I want to emphasize here is that we have representation from a wide variety of organizations, including nonprofits, government agencies, academia, and private business. And this is something that the collective impact approach calls for, so that we have diverse perspectives really steering the effort. And this leadership team serves as our decision-making body and has been really, really useful thus far. So Sandra introduced the 4 Essentials for Childhood goal areas, and I wanted to go into a little bit more detail on how Colorado is addressing each one of these goal areas that are featured here on the slide. So the first one, regarding raising awareness and commitment across many partners to promote these safe, stable, and nurturing relationships and environments and to prevent child maltreatment, Colorado is, first of all, very dedicated to forming a diverse collective impact team. This includes involving many key partners, both traditional and non-traditional. Just to give you some examples of some of our key partnerships thus far, I want to highlight the group who is running the Early Childhood Comprehensive Systems Grant here in our state, our State Department of Human Services, specifically the Office of Early Childhood. Here at the State Health Department in Colorado, other programs in the Injury, Suicide, and Violence Prevention Branch. And then several community-based and nonprofit organizations, including family resource centers around the state, home visiting organizations, and then what we call early childhood councils here in the state, which is a systems network for early childhood work. The goal number 2, using data to inform actions. We're taking this goal very seriously, and every step of our work in Essentials for Childhood is data informed in some way or another. I'll be going into a little bit more detail on that in a separate slide, but here just want to highlight that we are pulling together resources and expertise through a data work group. We also have a highly involved team of evaluators and epidemiologists, which include folks from the State Health Department as well as the Colorado School of Public Health. And then we are going to be doing some capacity building among our collective impact team members so that they're able to feel informed and comfortable making decisions around data, and they'll really understand what it means to make a data-informed decision. The third goal, creating the context for healthy children and families through norms change in policies, through norms change in programs. We are still in the formative stages of figuring out what this truly means, particularly around norm change. But there is one phrase that seems to keep coming up over and over again as we describe our Essentials for Childhood work, and so I decided to go ahead and include that here on the slide, and that's, it takes a village to raise a child. And so this is a norm that hopefully as we get more and more into the Essentials for Childhood framework, it'll really start to become a phrase that rolls off folks' tongues. And then as far as programs, what we're trying to do here in Colorado is really enhance the work of programs that focus on the individual and family levels of the social ecology. So there's already a ton of existing work in Colorado that has been shown to be successful, and we really just want to do whatever we can to highlight that work as we move to more of a systems and society level approach. The last goal, creating the context for healthy children and families through policies. Currently, there are possibilities for policy change at the state, local, and organizational levels. We're not sure exactly where the group will choose to focus because that will be determined through a strategic planning process, but did want to highlight that a couple of policy issues that keep coming up thus far are increasing family-friendly business practices, and then statewide policies around health care and child care. So this slide is to give you all a better idea of our timeline for this project and what we've done so far and where we plan to go. So it's a 5-year project, and we're currently about halfway through year 1. As I mentioned earlier, our leadership team is in place, and we are currently building a collective impact team, which at this point is pretty well formed. We've had quite a bit of interest across the state from a diverse group of individuals. We've begun the process to use data and resources to inform our strategic planning process. This includes an environmental scan and landscape assessment so that we can get a better idea of what's going on currently in Colorado, and that will inform where we want to go in the future. By the end of this year, we'll also begin the process to prioritize the scope of this project and prioritize strategies, because right now the scope of the project is quite large, and so we really want to have a focused approach, and that process will be informed through several different items that I'll be going into more detail in a second about. And then by the end of this year, we will have an action plan for the next 4 years as far as what our strategies are and who is responsible for doing what to ensure that those strategies are implemented. In years 2 through 5 of the project, we will be dedicated to implementing these strategies that we identified in year 1. So Renee did a great job of giving you all an introduction to collective impact. I just wanted to really quickly demonstrate the collective impact structure here in Colorado and what we're doing for Essentials for Childhood. So the backbone organization is us at the State Health Department, and then we work with the Leadership Action Team, or in other words, the Steering Committee, which I already mentioned a few minutes ago. And then we're in the process of building this large collective impact team, which will have representation from agencies and organizations across sectors, including business and faith-based communities, as well as sort of our traditional partners, folks in public health and human services and education. And all of these individuals will represent different areas of expertise as well as different areas of the state. So this slide details some information on the project launch that we did here in Colorado. So Colorado launched its work on February 28th of this year, so just about a month ago. The title of the event was Peaks to Plains and Bodies to Brains, Making Colorado a Place Where Children Thrive. The event served many purposes, including goal number 1, to raise awareness of safe, stable, and nurturing relationships and environments. It also helped us recruit for our collective impact team. We tried to give folks a really good idea of the type of work we would be doing moving forward. It also gave us the opportunity to educate on the Essentials for Childhood framework, as well as using a collective impact approach and what that really looks like. It also gave our leadership team an opportunity to interact with potential partners. We were trying to give the leadership team a chance to meet them and also give our partners a better sense of who it is they will be working with over the next several years. It also gave us the opportunity to start to assess priorities in Colorado. We had some large and small group interactive activities, and that's where we started identifying issues that I briefly mentioned earlier, like family-friendly business policies and issues around healthcare and childcare. We had folks from all over the state participate, either in person or via webinar. And we brought in diverse speakers to reflect the type of participation we're after, including a community leader, a business executive, a physician specializing in child abuse and neglect, and a 9 News reporter, which is a large media outlet here in Colorado. So I'll give you a little bit more detail on our collective impact team on this slide. The shared vision is going to be created by the team. Renee mentioned when she was talking about collective impact that the agenda is not set by the backbone organization. And so that's why at this point Colorado does not have its set of strategies identified. Rather, we'll be doing that collectively with all of these agencies who represent different sectors and different geographic locations across the state. What I really want to emphasize with this slide is that most of the time one organization can't do this kind of work on its own, but there's powers in number. Our team in particular is going to be very solutions focused, so always trying to remain positive and focus on strengths and what currently exists that we can build on. We're also trying to have as much of a diverse team as possible. So as I have featured on this slide, everyone has a role to play, and then I have several different sectors represented that include the sectors who we're trying to recruit. Colorado is very serious about having a diverse team, and diversity goes beyond sectors and geographic locations. We're also looking for diversity culturally as well as even gender diversity. So this slide goes into a little bit more detail of how Colorado is addressing goal number 2, to use data to inform our work. So we have a series of steps to inform our strategic planning process. The first to occur is this data work group, which will really be looking at a library of indicators around safe, stable, and nurturing relationships and environments. And the group will actually prioritize and digest, if you will, the indicators that will be used to inform the collective impact team moving forward. That will lead into a longer strategic planning process that has several components, including an environmental scan, a literature review on existing work that's been done to increase safe, stable, and nurturing relationships and environments, a GIS map of existing programs relevant to this work, a policy scan to look at any existing organizational and regulatory policies that specifically promote safe, stable, and nurturing relationships and environments. And then lastly, this August, we will, the collective impact team will be involved in a 2-day strategic planning workshop where we will assess what we currently know and identify those strategies for moving forward. So I wanted to share a few sort of lessons learned thus far for any other agencies who are considering implementing an Essentials for Childhood framework. The first lesson that I want to emphasize is relationships, relationships, relationships. It is so important to establish strong, positive relationships, particularly with us as the State Health Department being the backbone organization. We really want to emphasize to local partners how much we value their relationship. And so that means that we have to be very intentional about reaching out, recruiting for our team, but also follow-up calls and making sure that everyone is on the same page. So we intend to have a feedback loop so that we can ask partners on an annual basis how we're doing and just make sure that everyone feels like they're being heard and understands that their relationship really is valued. It also means that we're making meetings as accessible as possible for folks around the state by doing things like offering travel reimbursement and webinar options for all of our meetings. We are also working on capacity building so that all partners feel informed and comfortable giving feedback. So that includes capacity building around understanding and interpreting data, as I mentioned earlier. It'll also include capacity building around certain frameworks like collective impact or the social ecological model, for example. The second lesson learned is to not use public health jargon, and this is particularly important when reaching out to those non-traditional partners, such as folks in the business community. It's really important to sort of meet them where they're at and translate the message so that it's clear how this kind of work affects them. And for example, for folks in the business community, it's important to be very clear about how this type of work affects their bottom line and how it's a good return on investment, and use those types of terms rather than terms like social and emotional, which is specifically a term that I was advised not to use by one of our business partners. Lastly, I want to mention that this process, the Essentials for Childhood process and a collective impact process, is time intensive, but it's definitely worthwhile. So it's important to remember that this work is about breaking down silos, which definitely does take time because it's not the easiest route to go. But this is what collective impact is. And the reason why it's worthwhile is that it increases buy-in across sectors and at a local level. And so your partners have more ownership over the project. And so as you're moving forward with actually implementing strategies, you're more likely to be successful. And that's all that I have today for you all. My information here is here if you have any questions, and I will turn it back to Lynn.
Thank you, Sarah. If anyone has questions for Sarah, please go ahead and chat in your question, and we will try to get to as many as possible at the end of our program today. It was great to hear about what is happening in Colorado, and I'm really looking forward to hearing what is happening in Kansas. So I would like to present our next speaker. Our next speaker is Vicki Roper. Vicki is the Prevent Child Abuse Kansas Director for the Kansas Children's Service League. She has worked at the Kansas Children's Service League for the past 10 years and is currently the team leader of the Kansas Essentials for Childhood team. So I'll turn it over to Vicki.
Thanks, Lynn. I'm happy to be with you today. Okay. First, I wanted to talk just a little bit about some of the work that we've been doing with safe, stable, nurturing relationships and environments prior to Essentials for Childhood. In 2012, the Office of Child Abuse and Neglect selected 13 different promising practices and programs that they highlighted at their Network for Action meeting. And one of those was the CDC's project around working with business. And so the CDC approached the Kansas Children's Service League. We're a large nonprofit, 501c3, about $15 million, that is completely dedicated to the prevention of child abuse and neglect, mostly before abuse and neglect ever happens in the first place, and asked us to beta test their business portal model for the Network for Action piece with OCAN. And so as a part of that, they came in and trained 54 of our board members and foundation trustees and community council members in addition to our exec team. And so that's one of the kind of the great ways that nonprofits can be utilized in this work, since there's such a heavy emphasis on business, is with our boards. You already have people that are bought into to the cause, into this mission, and to this work, and they love having the opportunity to be involved with this kind of a project. To date, through those people that were initially trained and then them training additional people, we've trained over 2,000 people in Kansas in safe, stable, nurturing relationships and environments. And these have been business, parent leaders, service providers such as juvenile justice, corrections, child welfare, education, the media, members of the media, legislators in Kansas, community-based child abuse prevention, grantees, and early childhood folks, just to name a few. We held a summit meeting in 2013, and that was great, and it was an opportunity for everybody to kind of come together and just get started with learning about SSNRs and what this work is all about. It was a 6-hour day, and we also were able to kind of feature what's currently being done in this state. We then in May, I think, the FOA came out for this project, and we wrote a proposal. It was unable to be submitted. The writing team really wanted to learn these strategies. They wanted to be a part of all of this. We received approval from the CDC to be an unfunded state, and so we started to work to secure funding for this project. Letters of support had already, been written, and we already had a proposal, and so that made some things easy. But I think the addition of a lot of business letters of support really helped us to secure private funding. So I think that was a great thing and something that I hadn't completely thought through. We were able then to secure, I guess we've secured about $110,000 now in private funding through major donors to the Kansas Children's Service League, who'd been at that initial presentation with the CDC and had really bought into all of this, and then through our Healthcare Foundation of Greater Kansas City, and then through another major donor who's kind of an entrepreneur. And I think this project really appeals to business entrepreneurs because it's something so new with such potential impact. These are our 4 goals, and the first one is really around collective impact, as everyone's talked about. The second one is really around the work groups and the steering committee, the larger group that's going to work on this. Because the Healthcare Foundation of Greater Kansas City is our primary funder, they have selected Kansas City, Kansas as the community that they really want us to focus on. So that's one of the things for the unfunded states, is once we go after the private funding, our private funders are going to have priorities for us as well. The evaluation is being done by the University of Kansas, and the final development of a toolkit is being done by the leadership team, and we will also have input probably from the Prevent Child Abuse America team that is also working with the CDC to develop a toolkit, and we'll be using some of the tools that the CDC is in the process of designing. Okay, this is just a list of our initial backbone team, and there's 3 organizations, 5 folks, and all 3 organizations are coming together to be the backbone for this process. The Kansas Children's Service League, which is a private nonprofit, our Kansas Department of Health and Environment, which is our public health entity in the state of Kansas, and then the University of Kansas Center for Public Partnerships and Research, which represents community-based child abuse prevention. The Kansas Children's Service League represents Prevent Child Abuse America and Circle of Parents. Okay, on background on Team Kansas, we've asked to be able to make a level 1 commitment, which just means we want to be an equal partner at the table with the funded states. We have already implemented a collective impact project for the prevention of child abuse fatalities in Wichita, Kansas. It has gone from 2008 to the present and is accredited as a community change initiative through the Council on Accreditation and received the Pinwheel City USA Award from Prevent Child Abuse America in 2011. There's now 122 partners working in that initiative from 65 agencies, and it led to implementing hospital-based shaken baby syndrome prevention, fatherhood project, crisis nursery, real support for parents, which is concrete supports, education and awareness for the medical community, high schools, university pre-service social workers, finding champions in the media to help get messages out there. We went from 8 fatalities in 2008 to 2 in 2009 to 1 in 2010 to 0 in 2011 and 2012, and that's in the birth to 5 age group using Wichita Police Department data. The other real critical thing we think is that we've developed and have worked on a lot of projects together, a strong trust level. So I think there's a strong trust level. We recognize that this leadership team will change over time as we pull work groups in and begin working toward our collective impact goals, but this is where we're starting. We also recognize that we're going to be utilizing our strengths with this project. Friends National Resource Center views our strength as parent leadership. They list next to the state of Kansas parent leadership, and that's our Parent Cafe work, Circle of Parents, Statewide Parent Leadership Advisory Council, and Parent Leadership Conference. The University of Kansas Center for Public Partnerships and Research, another backbone group, developed the Protective Factor Survey in 2010, which is reliable and valid, and we'll be calling on that. And then the Prevent Child Abuse Kansas chapter was the first PCA chapter in the nation, founded in 1976, and the Kansas Children's Cabinet and Trust Fund was the first children's trust fund in the nation, founded in 1980. So we really see ourselves as pioneers. All year we see ourselves really working, especially in year 1, around public awareness work, data compilation and data work, and then policy. We've already been doing some policy things this legislative session with our Child Death Review Board, trying to get more questions to be able to be asked and more information that can drive prevention in the state. In the spring, we've started working with Jeff Linkenbach and Montana State around community norms change and a community norms change project. In April, we'll be having our first larger group committee, and Sandra Alexander from the CDC will be joining us. So right now, we're spending a lot of time individually just talking to people about coming to that meeting, and then hoping that we'll be able to secure a committee or steering committee out of that effort. Also in the spring, we have been working on sort of protocol around this work for working with families, for working with parents, and we're piloting that. This is something we're doing, Kansas is doing with Iowa, and piloting that with Iowa McVee and Kansas Community-Based Child Abuse Prevention Families. In the summer, we should begin pulling together some type of a team from Kansas City, Kansas to begin looking at work there. Then in the fall, we'll be starting on our business model and looking at how we want to do that. We're at this point with our business partners are kind of looking at a project that will increase family-friendly policies in the workplace and then in the community as well. And then in October, we're planning on holding a second summit meeting, just kind of moving up a level in everybody's knowledge and commitment, and coming out of that with hopefully a plan. And that would be another 6-hour day. And then hopefully by the end of the year, we're looking at developing at least the beginnings of a toolkit that can be distributed. So I think our goals really are around creating a culture change in Kansas, and our kind of a quick thing to other nonprofits is our role as a nonprofit is really being able to bring business to the table through a board of directors, securing the ability to secure private funding through major donors and foundations, you know, having already had those relationships, and then advocacy work. So that's it.
Great. Thank you so much, Vicki. That was helpful to hear what's happening in Kansas. And our next speaker is actually going to give us some more perspective in Kansas and maybe across. Our speaker is Paula Clayton, and she serves as the Director of the Bureau of Health Promotion in the Kansas Department of Health and Environment. She has responsibility for chronic disease and injury prevention programs, including intentional and unintentional, and she also serves on our ASTHO Senior Deputy Committee. So I'll turn it over to you, Paula, to add some perspectives from where you sit at the Kansas Department of Health and Environment.
Well, thank you very much, Lynn, and good afternoon, everyone. I bring greetings from Dr. Bob Mosier, our State Health Officer, who is unfortunately not able to join the meeting today. Dr. Mosier serves as a current board member of ASTHO, and I join him in applauding the Kansas Children's Service League and University of Kansas Center of Public Partnerships and Research for their leadership to move this project forward in Kansas. Our State Health Department is very pleased to be a part of the partnership that Vicki just described, and from her remarks you know that our Injury Prevention Program Director, Lori Haskett, serves as part of the leadership team. And as is important in, as Sarah noted as well, it's important to have those champions in the State Health Department. Lori is certainly a champion for injury prevention and quick to recognize the connection of the essentials for childhood with the broader set of health challenges that Sandra and Renee described early on in their introductions in our meeting this afternoon. So as you have just heard from Vicki's presentation, this project has truly become a public-private initiative in Kansas. We are really pleased to have business involvement with the project as an important partner in health promotion, which I noticed that Sarah noted in her presentation as well. One of the initiatives that state health departments are typically leading, and this is certainly true in Kansas, is to facilitate development of state health objectives as we look at the health challenges that face us today and where we are going in terms of improving health for our citizens. This is the same in Kansas. In 2012, our KDHE Secretary, Dr. Mosier, led the Healthy Kansans 2020 planning process, and this involved him convening a panel of over 35 agency and organizational leaders. We reviewed Kansas health data as compared to the Healthy People 2020 objectives to identify areas where we could collectively, across organizations, have a meaningful impact on improving the health status of Kansans. Certainly, while health priorities such as these are not always necessarily the responsibility of the state health agency to lead, it is the state health agency's responsibility to identify those health priorities. So in Kansas, as a result of our process, 3 cross-cutting themes were identified, and one of the cross-cutting themes related to healthy living, which we defined as Kansans being equipped to take an active role in improving their health and supporting their families in making healthy choices. One of the 5 priority strategies that our Healthy Kansans team identified for this particular cross-cutting theme was focused on improving supports for the social and emotional development of children and families. So it was perhaps through these Healthy Kansans 2020 discussions that served to help us fully recognize the importance of this strategy, particularly as it relates to adverse childhood experiences and lifelong health. In Kansas, the Essentials for Childhood project is one of the programs that is recognized as one that supports this particular Healthy Kansans 2020 strategy. The project supports the collective state efforts to implement data-driven public health tools for child maltreatment prevention, such as collective impact, public awareness, community norms campaigns, and evidence-based program models that impact population-based change, as Sarah and Vicki both described. We have made progress as a state health department in collecting baseline data on this topic as well. The Kansas Children's Service League and the University of Kansas Center for Public Partnerships and Research were instrumental in identifying supplemental funding or additional funding to add to the resources that we had available in our injury program, so that KDHE was able to add the Adverse Childhood Experiences module, the ACE module, to our 2014 Behavior Risk Factor Surveillance System. And as many other state health departments, this is a telephone survey to track and monitor the status of health risk behaviors of Kansans that is conducted as part of, with guidance from CDC every year throughout the year to monitor the changes in health risk behaviors among the adult population. So we are currently asking the questions for the ACE module in our 2014 survey, and anticipate that our first state-level data on this topic will be available and serve as baseline information, which our epidemiologists here in the State Health Department will analyze and report on. So in summary, I think the Essentials for Childhood project helps us to meaningfully address root causes that are underlying many adult health and mental health issues and early death, and to intervene earlier in the process of injury and disease development. So again, I would applaud the work that others are doing across the country to do some of this upstream prevention work, and we particularly appreciate the collaborative of our partners here in Kansas as we work to improve the overall health of the people in our state. So thank you, and I will turn the microphone back to you, Lynn.
Thank you, Paula. Great examples, really helpful to hear what's going on. And so thank you to our participants who have started to chat in some questions. We do have about 5 minutes to respond to get some panel responses to your questions, so feel free to add. We have 3. And I wanted to start with the couple that came in for the Kansas team, since that may be fresh on everyone's minds. One question came in for the Kansas team that, and this may have been during Vicki's presentation, that 2,000 people were trained in safe and stable nurturing relationships. The question is, what did this training consist of? Who were the folks that were trained? And what has happened as a result of the training?
Well, a lot. I think the folks that were trained were from, all different program areas. So we really worked across systems. We kind of tried to work peer-to-peer. We trained 50 of our supervisors, directors, and exec team members, and then the ones that were working in juvenile justice trained juvenile justice. Those were working in child welfare trained those folks. Those were in corrections. So everybody kind of worked peer-to-peer. A lot of prevention trainings, early childhood, worked with legislators, the media. Parent leaders was huge, was really big. And at this point, we just sort of did Sandra Alexander did a webinar for folks in Kansas from the CDC around, there were some slides around average childhood experiences, but also around safe, stable, and nurturing relationships and environments. So we just laid the groundwork for this. As you can imagine, it just kind of got people started asking, okay, so now what? So where are we going with this? So what are we going to do next? We trained a lot of dads in the correctional facilities in Kansas that were about to be released, and they obviously, want to do more and want to train more people. And this was in the context of an evidence-based model within our correction system, so it wasn't just open to anyone. But I think that at this point, obviously, we will probably pull that collective impact team together around what are next steps and what do we do around this. So we've had an interesting experience in that most people don't know this information. They don't know the research, and they don't know anything around, the application of the research.
Great, that's really helpful. And just to keep in the Kansas section of questions, one question popped up during, Paula, your presentation when you were talking about including the Adverse Childhood Experiences Survey in your state's behavior risk factor surveillance. And the question was, are you asking the neglect question?
Mm-hmm. Yes, that's a great question. And we are asking the CDC standard module, I believe, and I would have to double check to make sure that that is actually in that module.
Okay, and that is information that we can also share back with participants in the post-meeting information that we share out. And Paula, I'm sorry if I interrupted, if there was something you wanted to add to that.
Nope, you've got it. Thank you.
Oh, okay, good. Great. Now we can sort of go back to the first chat question that came in, and this came in during, I think it was Sandra and Renee's presentation, and in one of their slides they referred to integrating health equity into the work. So the question is, around integrating health equity into this work, how is this being done in the funded states? So I would direct that question to Sandra and Renee.
One of the first things we did was to provide some information and training at our grantee meeting in January to all of the states that were present, which included the 5 funding states and 13 of the unfunded states. We will be doing additional webinars and providing additional information from our health equity team here for our grantees and the unfunded states on health equity. And I know that some of the states have started beginning to talk about and look at that and think about how they're going to do that.
And just to add, I mean, because this is year one, this really is more of a planning year and getting things started. So I think no one's gotten fully underway. So that would be a great question to ask within the next year. But of course, we mentioned Raising of America is one. That's just a piece. That's just a tool for people to use. But that is something that I know some of the states are interested in trying to capitalize on to really raise awareness and commitment around that topic.
And I believe one of the webinars in this series will also focus on that topic.
That's right, and that's a great segue actually, because I'm noting that it's 3:59, and any questions that were chatted in that weren't addressed, please know that we are going to be hosting 4 additional webinars, and any questions that came up we would like to factor into finding ways of answering those questions in the subsequent webinars. So really on behalf of ASTHO, I want to thank you again for joining us today. As I mentioned earlier, you will be immediately directed to an evaluation at the conclusion of the webinar. Please fill it out. It provides us with very useful information that will help us make the rest of the series successful. I also wanted to thank CDC and the National Center on Injury Prevention and Control for sponsoring the webinar, and certainly thank our very knowledgeable speakers today, Sandra Alexander, Renee Wright, Sarah Hernandez, Vicki Roper, and Paula Clayton. I would also like to quickly thank our staff who helped to develop this webinar. And again, this is the first in our series around Essentials for Childhood. We hosted over the next few months. The presentations and recording from today's webinar will be made available to you via email within the next few days. Also, please check back to the ASTHO website that you see up on your screen for more information about upcoming webinars in the Essentials for Childhood series. So thanks to everyone for participating and for your questions, and please enjoy the rest of your afternoon.
Ladies and gentlemen, this does conclude the webinar for today. We thank you for your participation and ask that you please disconnect your lines.